Welcome to another episode of the Patient Voice Amplified. I'm Adam Cherrington, and I'm here with my partner, Dan Czech.
It's good to be with you again today, Adam.
You too. Thanks for joining. Well, we are very happy to welcome a new friend to class to this episode. Dalton Divakaran is joining us today, Industry Advisor for Global Healthcare at Salesforce. Dalton, great to have you here.
Thank you so much for having me today. Really an honor.
Oh, it's our pleasure. We're happy to have you here. Dalton, I just have to share with our listeners how we connected. We have not known each other very long, but in our very first introduction, it was clear you had a deep passion for listening to patients. And so Dan and I looked at each other and said, we got to have Dalton come tell his story and what he's working on to help amplify the voice of the patient. That's what we're all about on this podcast. So first of all, thanks again for joining. We would love for you to share your background and just tell us a little bit of how you got to where you are today at Salesforce.
Sure. My background, I grew up in India, born and raised there, and I've been a clinician and wanted to switch my career to the technology track. But there is a story behind all of that, right? Obviously, growing up in India, I saw firsthand the struggles of, back in 30, 35 years ago, it's just third world country. And people were just struggling even to access healthcare, or in general in life, there was poverty all around. And my story begins where my mom, when she graduated out of nursing school, and she wanted to find a job. So the job was really far away from our house. And then when she wanted to move, she had both of us, me and my sister, and she couldn't find or afford a place to stay. So she rented a house, which three other ladies who were in the similar boat, whose husbands were away in the Gulf or away for work or in the Army or in Indian Navy. So these three women came together and they rented a house, and my mom started working as a nurse. But one day I realized she locked me and my sister up in a room, and she was gone for the entire day. And growing up as a child, I couldn't really fathom it. But when I started to get a little older, I have been just witnessing her life, and what she was doing was serving her community. And she went out and served patients who couldn't afford a wound care or put in an infusion for antibiotics for a week. And she would go and serve. She didn't become a millionaire. She didn't build a great mansion. But what she did was impart those values to me and my sister. And growing up, I never thought of it intentionally, those values, but looking back, my career, just being a nurse, seeing her and wanting to help people, I went into nursing. But when I went into nursing and graduated, my first job was only 3,000 rupees, which was not even $50 a month for 16 to 18-hour shifts and 26 days in a row to get 4 days off. And just seeing the struggles of patients and clinicians, I was like, there is a way to do this even better. And I want to go and explore and learn from the very best how it's done around the world. Or that's how I started looking into universities for a management program in healthcare management. And I applied, and that's how I moved to the US. And meanwhile, I graduated. I started working as a nurse. I ran a home health practice. I was initially doing cardiology, then was the chief of clinical quality. And those experiences as a clinician, but also those experiences being firsthand as a patient, right? I had a couple of near-death experiences in life and navigating healthcare system, not just in India, but also in the United States, and going through the pain. And I just realized, healthcare needs a lot of work, not just in India, but also in the US as a patient, and going through that. That kind of really propelled my career to change from bedside nursing into technology, where I could see, I can make a massive impact, a bigger impact, but really understanding what's happening on the ground, connecting those dots and applying technology to areas where things could be improved. So if I would point to 2 or 3 major points in my career transition, one is those core values that has been imparted to me. And 2 is that journey as a clinician, but 3 is also equally important, the journey as a patient myself in different healthcare systems.
We could probably have an episode on each of those 3 journeys right there. And what a special legacy your mother left. What a great tribute to her by what you're doing. I really appreciated that story.
Thank you for having me on the show, but I'm sure that you both would also have a story to share about your experiences and what drives you to come every week or every month and host a show like this and talk more about patient experience and how you can leverage that and make healthcare better. I want to hear more about that.
Well, yeah, thanks for asking. Do you want to go first, Dan?
Sure. I think, everybody has their own patient story or a family member that's had a patient story and where you see opportunities for it to get better. Adam and I get to live this every day as we talk to provider organizations, payer organizations about their experiences. But for me, I have a younger sister that I lost several years ago, and she had a rare blood condition that we didn't know about, and it took the doctors quite a while to figure it out. And I often wonder, how could technology have facilitated this? Could there have been tests that were run? Could there have been, better information sharing across physicians and her care team? They could have figured it out early on and maybe have saved her life. It's not something that burdens me every day, but it drives me to try to make that experience better for other patients.
Oh, thanks for sharing that, Dan. And Dalton, I've had two experiences that really drive my passion here. The personal experience is about 10 years ago, my wife was diagnosed with stage 1 breast cancer. And our experience was such that we returned a phone call to a nurse that shared the diagnosis. And it was on a Friday night, 6 o'clock, and basically said, okay, you have breast cancer. Do you have any questions? And they said, a surgeon will be calling you in 5 days. And that's all we were given. And we went from that dark, dark place to getting a lot of hope by getting information and communication and understanding. But even throughout that journey, we met with an amazing oncologist, and just, here in the state of Utah, there's some fantastic access to healthcare. And the doctor basically said, well, you can have 4, 6, or 8 doses of chemo. Which one do you want? And really left it up to us like that. And it just floored me that some of the most challenging healthcare journeys of our life was left up to us to just figure out. And so, taking that experience and what we get to do at class and hopefully help improve healthcare for others, it's really driven my passion to include patients. The second experience is a report that Dan and I did, where we interviewed patients and compared their responses to what vendors and providers were focused on. And the gaps were pretty startling. Not that people were focused on the wrong things, but they were focused on different things than what patients needed. And we quickly felt and experienced that this is a whole corner of the industry that needs a light shined on it. And so that's impacted our current research. We have plans to go way deeper with a proposed collaborative where we want to highlight things where organizations are successfully listening to patients and they're including their perspectives. And our hypothesis is we believe that organizations will achieve their goals faster and easier if they focus on the patient's outcomes related to engagement, related to participation and experience and their overall journey in care. So it's as we had that experience with that report and we started to talk to people, it's clear that there's a lot we can all learn from each other. So that drove the idea for the podcast, and we get to meet colleagues like you and hear your stories.
Well, thank you so much. I'm sorry I had to go through all that, but you guys took some action after that, and it's making a big difference. So thank you for doing that.
Oh,
you bet.
Thank you. Thank you. So Dalton, tell us what you're doing these days. Guide us on how you are trying to include patients in your work and your efforts, and we'd love to hear more about that.
Today, I serve as an industry advisor for global healthcare at Salesforce. So there's a unique story how I came to Salesforce. Prior to Salesforce, I was doing large-scale implementations for a payer. But during that time is when me and a few of my friends started a nonprofit where we cater to vulnerable women and children around the world. So we wanted to actually put a platform in place to run these operations and the programs. And that's how I came across Salesforce, because they give 10 free licenses to nonprofits. And I started to explore more about it, and then found that Salesforce was in healthcare. And this is what I do Monday through Friday. And I went to the Trailhead website, and there was this cool trail where you could build an app. So I started building a small prototype of an app I always wanted to build as a clinician. And that low code or no code capability that would let me as a nurse or clinician build an app without the help of any developer was pretty phenomenal to me. That's what attracted me to Salesforce. And in my current role, I get to serve as an advisor for all our customers, but also for our internal teams with our product. Work really close with our product teams to really understand the perspectives of what patients go through or what clinicians go through in real life, and to really develop products or capabilities that really resonates with the end users and have the best and most impact.
And at a big organization like Salesforce, how do you get to the individual patient and understand their needs and their desires and the way they want to interact with technology?
Yeah, so we constantly listen to our customers, and that's where our innovation thrives. Or when our customers thrive, we thrive. And it's a constant journey of just being where they are at, even shadowing them in their day-to-day activities in some cases, and constantly having that open dialogue, right? As a technology company, we don't know everything about healthcare. And the customers the organizations, healthcare organizations that work with us really don't know about the entire capabilities that a technology company can bring to them. So it's just a constant dialogue and open conversations and being honest. Like, if we haven't done that, what is important for you? What do the process look like? How can we transform the way you're doing things and scale it up so that more patients can be served or more efficiencies can be brought into this process? So it's kind of constant dialogue back and forth. And we have a leadership that supports that transition of like where we get the knowledge, which would flow upwards to our product, and how we prioritize what goes out, which has the best impact. One quick example is when COVID happened, right? The pandemic, we rolled out products that would help, states and, even national healthcare associations rapidly implement, policies or, vaccination programs in a matter of weeks. That's just how constantly listening to them, what citizens want, and constantly listening to leaders and getting that information back to our technology and product teams in an efficient and a very prioritized manner.
Dalton, I noticed on your bio, you're a founder of an organization called, is it Ethne, I believe?
Yeah, it's Ethne.
Teach us about that. Tell us what that is.
The word ethne means people groups or nations. And growing up in such a diverse country like India, I've always been fascinated by people. So if we move from Kerala to Tamil Nadu to Maharashtra, they're all states, right? Different states in India. The culture is so different there. The language spoken by each state is different. And there are tons of dialects within each languages, right? So I've always been fascinated. And then I got an opportunity to travel abroad and be in the US and travel to other countries. But that passion for people tied to my story of my mom, growing up and raising us, she struggled and she went through a lot, and she faced firsthand abuse, but she never gave up, and she still served. She was happy. She imparted great core values to us. So that really drove me to start something when I'm in a better place, so I could give back to vulnerable women and children. So this whole idea was initiated through those experiences. And my wife was on board, and then I pitched the same thing to a few of the professionals working in large corporates who also was looking for meaning just beyond their 8-to-5 jobs. And they said, yeah, we are with you. So it was a group of people from finance, marketing, operations, who were doing really well in their corporate careers, who came together to form programs that would empower vulnerable women and children. And the primary goal is to educate them, people from backgrounds of either victims of sex trafficking or their parents have been involved in sex work, or from really marginalized and vulnerable communities. We send them to nursing schools, we send them to engineering schools, medical schools, whatever their passion is, and we empower them and walk with them to go through that journey.
Oh, that's fantastic. So if someone wants to get involved, share with us how they connect with you.
Absolutely, yeah. You can go to our website, ethne.life, and you can subscribe to our newsletters, and there are opportunities to volunteer and work with us and partner with us.
That's great. Well, thank you for that great work. What a cool thing to be involved in. That's great.
Yeah, one thing I was really proud of, it's been only a 3-year organization, but during when COVID hit India last year, I was really able to find like a convergence of my professional career and my passion in nonprofit all culminating at one point. So my nonprofit, the leaders were willing to pivot and support India during that crisis. So we rallied and sent out a bunch of ventilators, oxygen concentrators, PPE kits. But the cool part, was all that I was able to go down there and then go up to the northern part of India a little bit, and we established a virtual clinic in a village where some of the folks there have not seen a doctor in their lives before. And just by going and being on the ground and implementing technology and seeing people, and I still remember the spark in an elderly gentleman's eyes, and like, wow. And that was enough to fuel my passion for healthcare and to serve patients all over the world. So that was a unique opportunity that I got last year, leveraging the technology side of where I worked on an 8-to-5 job, but taking that to something more meaningful and more passionate, much passionate things that I enjoy in life.
That's so fascinating. Excuse me. I'm curious, having traveled all over the world and your unique position working with the customers of Salesforce, what have you seen in the U.S. that other countries could potentially leverage regarding that technology experience with the patient, and vice versa? What have you seen outside of the U.S. that perhaps we could be doing better here?
Yeah, that's a great question, and a lot of things to really reflect on, the last few months or years when I've traveled abroad and been in the U.S. working with customers. One of the things here is like, in the provider space, things are a lot tied to EMRs or the regulations much more deeper in the construct of the healthcare system in general, right? Who pays for certain things? If you have insurance, what kind of insurance? Does it completely cover something versus do you have access to, healthcare if you don't have insurance? And those kind of things, when you go into some of the countries, this doesn't matter to them. Obviously it does. So one example is in Spain, when I went there, they have nationalized a public healthcare system. Healthcare is free and you can go get treatment for whatever you need, but access is still a problem there, right? How can government hospitals or agencies support their millions of population just with the help of government hospitals or government initiatives? You need a private sector to do that. But on the other hand, coming back to the U.S., most of it is privatized, and there's nothing for a layman who doesn't have insurance just to walk to a hospital and get treated for it. And you pay a hefty bill. Obviously, there are programs that support it, but you need a balance of both those kind of systems to really, really serve your citizens and the population. And it should be a great collaboration between the private sector and the public sector to come join forces together to really make healthcare reasonable and efficient and accessible to everybody, no matter you're in a rich country, in a poor country, or no matter what geography you are in.
Dalton, what advice would you give our listeners about how to include patients more in the technology needs and preferences and things like that? From your perspective, what else should the market do?
I love your passion for, being to include patients in everything you do in healthcare, right? Because ultimately, whatever we do in technology or in healthcare, it's serving the patients. There are the folks that who gets the benefit in the end of it. And when you look at the whole entire stakeholders in the healthcare ecosystem, right? So why not include them in every decision, right? And it's crucial. And the healthcare journey for someone doesn't start when you go into a hospital or start seeing your physician for the first time. It begins when these days, when you pick up your phone and you search Google, okay, who's the specialist for the X and Y problem that I'm facing? From that minute to getting an appointment, to seeing a doctor and walking them through the journey if they have to get treated or a surgery, each part till when they recover from it, and the ongoing part, healthcare covers like a lot in an entire spectrum, right? Like, and to really understand the journey from end to end, who better than patients who have walked that path to impart some wisdom into how technology should be made. And these days, we're all empowered about technology. Some of the patients that we see knows much more than technology than we do. And they can say, why don't you do that? And why don't you do this? And finding those folks who can give you feedback, not just when you're a provider organization or a payer organization, but when you're a tech company or trying to solve some of these problems for payers, providers, medtech, life sciences, pharma, you got to listen to their perspective to build patient-centric products. And that should be a priority for all these organizations. And even if it's a contract or a short-term hire, identify people who have walked that journey and have that stories, how they can really help you design products that really matter to patients.
Put music to our ears, right, Dan?
Yeah, that's fascinating. So where do you see the biggest gap in the industry today?
It's really to understand, we can talk about big innovation and mind-blowing concepts in innovation like AI platforms or things like that, right? But for me, I feel like there are so many smaller things that we need to fix in the process. And maybe technology always is not the answer, right? People in the process involved in care and delivering care is equally important. And technology, I feel, is the last piece to the puzzle where, it should aid in these, fixing some of these problems or helping to scale or helping to ease the efficiencies of some of these tasks. And technology should come in later. But we need folks that would understand the change management entirely about people and the process and how do we make that right, and then take technology and apply it where technology can make things better. For example, last year, I had to go and seek an emergency procedure from a hospital. So it was, I don't know if ever anyone have gotten a needle stuck to your spine for a few minutes and then had to be in the hospital, right? So this was one of those spinal taps. You got to be in the hospital for at least 6 hours, 2 hours before the procedure. Then the total procedure is probably 20 minutes, but then you have to stay another 2 to 3 hours. And totally it's 6 to 7 hours that you have to spend in the hospital. So I go in there for this procedure. I get the spinal tap done. I'll come home and I'm waiting for these results. And there were around 15 to 20 tests that the doctor prescribed, what they evaluate my spinal fluid, just CSF, right? And then the results came in and I only get 12 or 13 results. And I'm still waiting. I wait for another week, but the remaining results don't come in. The doctor doesn't care about it. Nobody calls me about it. But knowing, being a clinician, I know that these results are important. So I call the lab or the hospital where I went for this procedure, and they tell me, oh, we ran out of specimen. And I'm like, excuse me, did I hear that right? They said, no, we ran out of specimen. We didn't have enough specimen to do the entire test. So, being a case manager myself and, have walked this a million times for other patients and worked in this space, I'm like, this is not right. Who's your manager? So I escalate that instance. I contact my doctor, but doctor had no clue what was happening. There was no communication with the hospital, the lab, and my physician who was seeing me. And then eventually I escalated it to their senior leadership. And finally, they went to these different labs where they sent it out for different tests. They got the residual samples back after 2 weeks, and then they ran the tests again. And after 3 or 4 weeks, they got me the entire results. In the meanwhile, I was, I had some issues and I had to go to the ER. The cost of just going to the ER and the financial implications for the provider, just navigating these calls and sending people to different labs. Probably a procedure that costed $2,000 here might have costed them like $10,000. But most importantly, my experience as a patient there, and have to wait for four weeks. In the meantime, things getting worse. It was terrible, right? So how can providers consider these kind of experiences that patients will have and be open to feedback? And nobody from the provider office called me after that, hey, what happened? And how can we do this better? I think healthcare organizations and leaders should be more proactive in reaching out to patients. Say, how has this experience really been? And be open. We haven't figured out everything yet, but we want to make things better and find out some of these cases that they could talk to and take action after that, right? Once they know what could be made better.
Well, thank goodness you're such a educated patient in that case to know how to even navigate that. I would assume 99% of patients wouldn't know where to even begin to chase down those results.
Absolutely. And they was just stressed, oh, I only needed those 13 results and then the rest are probably not applicable to me, right?
Well, Dalton, it's been a treat to have you on this episode. Thank you for your passion and your insights, and would love to hear anything else you want to share with our listeners today related to your experience and what you'd like to see happen next in healthcare.
Well, I'm really excited about the fact that there's a lot of investments in healthcare technology, and especially during the pandemic times, everybody wanted to get into healthcare, make it better. And there's so much interest right there in making things happen. But what I personally feel with all these advancements in technology, I feel that the technology to make healthcare better is already here, and we're living in the now moment. And what I would encourage is for leaders across to be bold, to be courageous, and also experiment these technologies, and don't be afraid to leverage this to make things better. But the way you do that is keeping patients at the center of it. Prioritize what matters to patients before you prioritize your major incentives for making money. And that is crucial in building that trust with your patients within the entire stakeholder system of healthcare is key. And the way that you could do that is be authentic and by putting patients first and at the center of the healthcare ecosystem.
Dalton, thanks for what you're doing. Thanks for your leadership in this area. It's definitely needed, and we're inspired and really appreciate your participation here. So keep us posted on Ethne and how things are going, and if class can support you and your mission, we're interested to collaborate again. So thanks again. We appreciate you being here.
Well, thank you so much. It's been just an honor to just know you both and connect and live out that passion for keeping patients at the center of everything we do.
Awesome. Thanks, Dalton.
Thank you, Dalton. Well, Adam, that was a fun interview with Dalton. Like we said on that, it was an immediate connection we made at HIMSS this year. Tell me something you learned from our interview today.
Boy, I kept thinking about social determinants of health and access. So much of what we do focuses on the technology, and that's who class is. That's what we'll always do. But you think about those that struggle with access, and there's got to be other solutions there. So I thought about that and his charity work and some of the things he's experienced in his life. Is there a way to use technology to broaden the access for people? That's the first thing that jumped out. The second.
Well, I think the other part of that puzzle is not everybody has the same technology background or technology ability. Sometimes we assume we live in 2022 that everybody's got a smartphone and everybody is capable of technology. But when you think of access, there's a whole group of people you need to consider as well.
Yeah, absolutely. That came out in our patient voice report, didn't it?
Yeah.
There are some gaps in access to just technology, let alone healthcare. So his story about his mom touched me a lot as well. What a noble woman that raised her kids and taught them amazing values. That was a great story. Well, Dan, I want to ask you about anything that's popped up recently in research or calls you've had with provider friends. We always love to share with our listeners what's the latest and greatest we're hearing. So anything you want to share today?
Yeah, I don't have anything necessarily from a recent conversation, but I was fascinated. Another team at Class, our revenue cycle researchers, put out a report in the last couple of weeks on price transparency. And they interviewed 60 or so revenue cycle professionals on price transparency and the regulation and how they've handled it. And it was fascinating to overlay their data with what we've seen from our surveys of patients. So in our study of almost 13,000 patients, we asked a question, what factors are most important in choosing your healthcare provider? And the ability to know how much your care is going to cost came up over a quarter of the time. So you've got this demand from patients, you've got regulation pushing it. That doesn't make it an easy problem to solve, right? It's still challenging. Most of those that we surveyed on the rev cycle side, they talk about how the regulation's not clear enough, and they underestimated the amount of work it would take to really do price transparency the right way. But boy, if we can figure out how to solve that as an industry, you please patients, you hopefully improve outcomes, and what a great opportunity to make a great experience.
And I think we are quick to admit how complex that really is. We get it, right? And but at the same time, I think we can raise our voices and say we should be able to know how much something is.
Right.
That seems like a basic part of a transaction. And so,
I know you love Chick-fil-A. Imagine going to order 12-count chicken nuggets and they don't tell you until after you've paid what it was going to cost.
You wouldn't do it.
You wouldn't do it.
You'd say, well, why would I do that? So, yep. Thank you for bringing up Chick-fil-A again. I'm still waiting for my free meal from all this advertising we provide. So, well, Dan, another great episode. Thank you. Appreciate your passion and commitment to this topic as well. I don't have a specific quote to share with our listeners today other than I think we need to be listening more. People have needs, especially our patient friends. Let's just keep listening in the development of tech, in the deployment, what providers are trying to do. You have an active stakeholder in all of these things in the patient. And so I'm sure somebody famous said something like that. So we'll just go with that today.
Oh, thank you for that, Adam. We'd like to thank Dalton again for sharing his time and energy and perspective with us. We'd like to thank our colleague Jeff, who helps with the technology side of this podcast, and all of our classmates for gathering the great research that they do. And we look forward to our next episode.
Sounds great. Thanks for listening.